I'm Angelica Gregorian, the practice manager at Turmanis and Associates Clinical Psychologists, a psychology practice on the northern beaches of Sydney. And I'm sitting here with our principal psychologist, Turmanis.
Hi everyone.
Over the last 18 months, our huge focus as a practice has been on preventing clients dropping out of therapy or terminating therapy prematurely before they've completed treatment. Since focusing on this in our practice, more of our clients have remained in therapy and improved their treatment outcomes. Part of our practices and clinicians' ability to achieve this has come through the workshop you, Simon, ran on client retention previously in this practice. And you're now currently booked for two workshops in Sydney. At two psych practices. And can you tell the audience why they, as clinicians, therapists, or group practice owners, should attend and do this workshop?
Great intro, Angelica. Thank you. Great job. Hello, everyone. This is something I'm super passionate about, super motivated about, both here in our practice in Manly Vale, Sydney's Northern Beaches. We have 6 psychologists here, and what you'll learn as a psychologist or a therapist is the dose-response effect. So you'll learn about all of the modern contemporary research about how many sessions clients attend on average in Australia, which is only 6, and that 50% of clients actually need between 12 and 18 sessions to make significant improvement. You'll learn basically how most patients don't receive enough psychotherapy to reach even a moderate level of clinically meaningful change. You'll learn more about the dose-response effect, dose being a session, effect being the effect on the client or the patient. You're going to learn about the relationship between the length of time that your clients will spend in therapy and the quality of the change that the patient will experience and their treatment outcomes. You're going to look at meta-analysis research of 15 different data sets around patient outcomes as a function of treatment duration. You're going to learn how different symptoms with different populations of clients will improve at different rates. You're going to learn why holding patients in treatment until satisfactory gains are achieved is very challenging and should be a focus of your clinical practice. You're going to learn what client retention rates are and the uniquely different ways to measure these. You're also going to look at why client retention rates are so important. For example, what poor client retention rates mean for you as a psychologist? What does it mean for your clients? What does it mean for your colleagues in your practice? You're going to learn why clients cease or terminate therapy early, what excellent treatment outcomes are and how they can relate to your client retention rates. We're also going to help you learn how and why premature termination in psychotherapy happens and what the research tells us about how to prevent it. You're going to learn the 8 key areas of practice as psychologists or clinicians or therapists, and what we need to be mindful of, focus on and improve on if we're able to help our clients to stay in therapy and prevent them from terminating prematurely, based on all of the research from the 1950s until now. You're going to learn how to increase your client retention rates and help your clients achieve superior treatment outcomes and prevent them from terminating prematurely. And you're going to be able to learn how to assess quickly which clients might drop out prematurely, what to look out for, and how to prevent this and hold them in therapy.
Okay. So you've told us, Simon, how and why a therapist or clinician would benefit from this workshop. What about a group practice owner? Why is this workshop important for them?
Good question, Angelica. You're going to learn how to measure your team and individual clinicians' client retention rates. You're going to learn how to help your clinicians track and measure when clients are dropping out of therapy and the reasons why. You're going to learn how to help your clinicians understand the importance or the value of measuring, focusing on and improving their client retention rates, and help them be motivated and passionate about holding their clients in therapy long enough to do the work necessary to achieve great outcomes and prevent relapse. You're going to learn how to keep your clinicians accountable regarding the client retention rates, and also the reflective practice tools to continue to help your clinicians focus on and improve their client retention rates. So post the workshop, there are some handouts and some guidelines of how to meet with your clinicians regularly through the year to keep them accountable, keep them motivated and passionate, focusing on this. Also how to train your receptionists, your admin staff to position and educate clients at intake and during or booking in or cancelling of sessions, any communication with them to help your clinicians' clients commit to consistent sessions and achieve greater success in therapy. Of course, reduce them from dropping out early. And I guess you're going to learn how to really help your clinicians improve their client retention rates also. And that's going to lead to your reception, client liaison, admin team feeling involved and feeling an important part in positioning and educating your clients to achieve greater success in therapy. Of course, your clinicians and therapists, as I think we've experienced in our practice, are going to be very grateful to you as the practice owner for, I guess, keeping them updated with this up-to-date research evidence around client retention and training them in this evidence-based reflective practice to grow and improve as therapists. They're also going to thank you and hopefully feel more competent and confident in seeing and being able to assess which clients might drop out, and feel more confident and competent in the work they're doing with their clients because they're achieving superior treatment outcomes by holding their clients in therapy long enough to do the work needed. They're going to feel more satisfied in the work and in the practice. I guess you're also going to be able to confidently market your practice as we do to your referrers in the community and other psychologists, GPs, as one of the first practices to be up to date, informed and trained in client retention, and being able to, I guess, market that your client retention rates are good if they improve through working on it with this workshop. Hopefully your GP's referrers are going to be more satisfied with your service because your team are holding clients in therapy long enough to achieve superior treatment outcomes, and therefore you may get more referrals from GPs and referrers, which means you may need to spend less time on marketing, on getting clients in the door. Also, your clinicians are going to hold their clients for longer periods of time, which means you need less referrals anyway to fill their books. So less work involved in getting new clients if you're holding on to your current clients and they're doing great work in therapy. I guess your practice is going to grow, just like ours has. In 12 months, our practice has gone from 3 psychologists to 6. Partly, I believe, through, a big part of it, client retention rates.
Yeah, absolutely. And as practice manager, these are all things that I've experienced and seen, clinicians improving their client retention rates and having less of our clients dropping out and prematurely terminating from therapy, as well as the client liaison officers and our admin team really positioning clients early on from the start, and communicating the importance of consistent sessions to achieve greater success in therapy and reduce clients dropping out. So yeah, they're all things that I've seen firsthand here in the last 12-18 months.
And what would you say, Angelica, to really help the viewers understand what do you think's happened to the sense of our team here and how people tend to be at work day to day, maybe compared to 2 years ago,
Sure.
before we did any of this client retention stuff, what was the feeling amongst the team at times when it came to clients dropping out? You know, there were some of our, I guess, client retention rates back then weren't so good from a couple of our, well, one of our therapists in particular, right?
Yeah. So there has been a pretty big shift in the team environment for sure. There feels a greater sense of support between clinicians. You know, since running the workshop, everybody's on the same page, and we're all striving towards this very important focus of ours and goal, which is to ensure clients are sticking through and remaining for the duration required and not dropping out prematurely. So there's a sense of achievement. Yeah,
to help them better, really. Help them do the work so that we're actually helping them better. There's a sense of achievement and pride in people's work, and often we're talking about the service evaluations we get are very positive from all of our clients. So it's made a huge difference, hasn't it?
Absolutely. Yeah.
Thanks for sharing, Angelica.
Okay.
So I guess I look forward to seeing you at one of our workshops soon. I'm incredibly, as I said earlier in the video, incredibly passionate about this, and I'm looking forward to seeing you and your team at one of our workshops soon. Looking forward to working with you.